Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. 50 full-scale NEETPG mock tests and still we have around 40 days more for you to fight. Nice to see Ravinder, Doctor and many more who are all online. Can you please punch his voice loud and clear for all of you, Doctor? So every day we discuss one full-scale grand test, and these 50 full-scale grand tests, just like the actual NEET-PG exam, you get 200 MCQs. Nice to see Dr. Soni and many more. So you saw the paper before you come. First, go to the learnograph.com, download the question paper. Very nice to see Kuldeep, Ravinder, Soni, Doctor, and many more. Please inform all your friends in the WhatsApp, Telegram, Instagram, classmate groups, everywhere that the live class has started. Every day, one free session of the discussion. But unless you go to learnograph.com, download the PDF by paying just $500, solve the question paper, and come prepared. There are 200 mind maps in which the explanatory answers are being provided. Each mind map will revise all the essential high yield facts for each of these questions. So nice to see 10 online classmates. So doctor, let's make the great beginning. Yes. A historical surgical technique. What is historical? Historical means we are not doing it anymore. What is this? This is called Calvel-Lux operation, which involves an incision made to access to the maxillary sinus through a sublabial incision is what you have to basically remember. A teenager presents with a nasal obstruction and a visible mass in the posterior nasal cavity, as what you can see here. So this is anthracoinal polyp. It is a solitary polyp which is extending from the choana and visible below the soft palate. And you need to put a postnasal mirror in which you can appreciate. Once more, doctor. In one mind map, I give to you everything that you need to remember about anthracoinal polyp, the treatment options, clinical significance, diagnostic features, etc., etc. Now, a patient presents with a non-healing ulcer on the lateral margin of the tongue that has been persistent for over almost 2 months. Biopsy show squamous epithelial cells which are arising from the epidermis and extending into the dermis. There is abundant eosinophilic cytoplasm, keratin pearls. There are keratin pearls in the histology. That means it is a squamous cell carcinoma is what you need to remember. So how do you treat it, doctor? Partial glossectomy with the neck dissection is considered to be the treatment of choice. In the neck dissection, you do the surgical removal of the lymph nodes in the neck to address or prevent the metastatic spread. And typically, squamous cell carcinomas are highly vulnerable to the radiotherapy. Radiotherapy is the primary adjuvant therapy in case of the squamous cell carcinomas. A patient presents with a persistent white patch on the tongue that does not rub off, as what you can see here, a white patch on the tongue. The patient denies any dental trauma or irritation or any smoking. You need to do a biopsy. Non-removable white patch typically should be considered He has a history of smoking, yes. Third, he denies any dental trauma. So that means you need to exclude oral leukoplakia. And this is what you are able to see now. A 65-year-old former construction worker undergoes a routine CT. So what do you see in this CT, doctor? You're able to see the calcific plaques which are there on the pleura, with the thickening of the pleura. So these plaques typically in a patient who is a former construction worker is more likely to be because of asbestosis is what you should suspect. A patient undergoes the CT. So what do you see on the CT, doctor? Displaced crus sign. The crus of the diaphragm is being displaced. Then diaphragm sign. The pleural fluid is noted as a in the shape of the P. You are able to see in the shape of pleural fluid is located above the outer surface of the diaphragm, outer surface of the diaphragm. So this is called diaphragm sign. Between the lung and the diaphragm, there is an interface which is being formed. So that is the reason this is right-sided pleural effusion. Diaphragm sign, interface sign, bare area sign, displaced crus sign. You need to be very sure about radiologically. A patient presents with the symptoms of hypercalcemia, muscle weakness. Systemic scan is being done. So what do you see here? Parathyroid adenoma is the most important cause for the primary hyperparathyroidism is what you have to remember. A patient with symptoms of pressure in the chest, difficulty in swallowing, and you see a anterior mediastinal mass with coarse calcifications, which is very typical of thymoma. So what are the four important anteromediastinal masses, doctor? Four T's you should remember. T for thymoma, T for teratogenic teratoma, thymoma, teratoma, T for terrible lymphoma, T for retrosternal thyroid. They're all the ones which are the anterior mediastinal masses is what you should remember. A newborn presents with rapid breathing immediately after the birth and a chest radiograph has been done. So hyperinflated lungs, streaky shadowing, and the fluid in the horizontal fissure, along with a rapid breathing shortly after the birth is transient tachypnea of the newborn is what you need to remember. Typically, it appears shortly after the birth and it lasts for up to 72 hours is what you need to remember. 72 hours it will last. So, doctor, you need to be quite sure of all these topics like meconium, respiratory distress syndrome, and transient tachypnea of the newborn. Everything, anything, you need to be quite sure, doctor, right? So, Yeah. A newborn exhibits signs of respiratory distress. Respiratory distress. And you have been given a chest radiograph. On the day one, there are mild changes. By day three, they became advanced changes. Fine reticulonodular shadowing indicating interstitial edema. So, prominent air bronchograms, you are able to see the air bronchograms, right, doctor? So, this is all indicative of respiratory distress syndrome. A patient with sudden onset of severe chest pain, back pain, CECT has been done. What is your diagnosis? So, this is aortic dissection, which is a type B aortic dissection involving the descending aorta, is what you need to remember. So it is the tear in the intima of the aorta, distal to the subclavian artery and extends into descending aorta and abdominal aorta, is what you should remember. A patient with chronic heartburn undergoes the barium swallow. So what is this typical appearance you are seeing, doctor? Radiologically, reticular pattern, a net-like pattern. A pool of barium is noted and can alter the mucosa, highlighting the irregularities. Also, you can see the hiatus hernia, often associated with Barrett's esophagus, is what you should identify. A newborn with excessive drooling, choking episodes, and a chest radiograph, what you can see when the nasogastric tube is passed, it is curling like this. That means esophagus is atretic, so that it is unable to pass down. So esophageal atresia will lead to infolding of the nasogastric tube, and the salivary drooling, etc., is the classical finding. A patient reports difficulty in swallowing, sensation of the food sticking in the throat. A barium swallow has been done. So what do you see here in the barium swallow, doctor? You can identify the web like a thin linear projection across the esophageal lumen. And the lateral projection, you can see that the web is constricting the esophageal lumen. So it is a classical case of esophageal web, is what you should remember. A 70-year-old presents with the complaints of swallowing difficulties, regurgitation of the food, particularly several hours after swallowing. So what do you see here? Typically a Junker's diverticulum. Can you appreciate it, doctor? Junker's diverticulum. So it is a pharyngeal pouch that forms because of the weak point in the pharyngeal muscles, typically just above the esophagus, commonly seen in older people, is what you should identify. So I leave the literature for you in one single mind map. Now, a 24-year-old undergoes an imaging study of unrelated symptoms and incidentally finds a impression on the esophagus just above the aortic arch. The left anterior oblique view is being shown. So this is a case of aberrant right subclavian artery, right? It's a congenital anomaly. It leaves a indentation on the esophagus, is what you should identify. A patient presents with hematemesis, an episode of intense vomiting. A barium swallow test has been done. So what do you see? A barium swallow is showing the barium which is tracking through the esophageal tear, which is lying beneath the mucosa at the site of the injury. Right? So this is Mallory vis tear. Typically, the barium picture is what you should remember. A patient presents with severe abdominal pain and vomiting. So what is this called? Hemorrhagic discoloration over the flanks is known as gray Turner's sign, which is indicative of acute pancreatitis with hemorrhagic transformation. A patient has complaints of painful lesions in the mouth which are interfering with eating. There is a lesion in the buccal mucosa, which is typically net-like pattern, Wickham striae, which is seen in the case of the lichen planus, is what you should realize. A patient with known history of psoriasis comes to the clinic with new psoriatic patches in the areas where he had abrasion. So what is this called? Koebner's phenomena. A patient presents with recurrent episodes of the skin purpura. Even on minor pinching, it is appearing. Minor pinching also it is appearing. Unexplained weight loss, fatigue is there. So what is, these are called pinch purpura. If you pinch it, purpura is coming. Pinch purpura is due to the vascular fragility. Whenever there is a AL type of amyloidosis, that's the reason you need to do serum protein electrophoresis is considered to be the essential part of the treatment. A competitive runner presents with a forefoot pain, as what you can see here, the forefoot pain. So it is the second metatarsal where you can see a stress fracture, typically seen in the case of the athletes, is what you should remember. A patient has a noticeable deformity. What is this called? Hallux valgus deformity. Lateral deviation of the big toe. And it often leads to bunion on the medial side of the foot associated with that. Hallux valgus is what you should remember. Now, a patient presents with a pigmented lesion on the back, which is being shown to you. A pigmented lesion in the back. Can the online students can punch? Is the voice loud and clear? Good. Rakesh Patel, Dr. Kuldeep, everyone, the voice is loud and clear. Thank you, doctor, for the feedback. So what you can see here is malignant melanoma. Any pigmented lesion with multiple colors with irregular borders is always a concern of malignant melanoma, is what you should remember. A patient presents with acute abdominal pain, chest X-ray is being shown to you. So what do you see here? There is a gas under the diaphragm. What can you see here? Gas under the diaphragm, which typically occurs whenever there is any perforation, like the duodenal ulcer perforation. You see the gas under the diaphragm is what you should remember. Good. Now, doctor, a patient reports sudden pop in the back of the ankle followed by pain and swelling, right? And during the examination, you can see a palpable gap in the Achilles tendon, right? And the plantar flexion is absent, which is called Thompson's test. Is a feature which is seen in the case of Achilles tendon rupture, is what you should remember. A patient falling on an outstretched hand. So what is this deformity? Dinner fork deformity in Colles fracture. It is a spotter that you need to recognize. A patient presents with a severe ankle pain and visible deformity, X-ray happen is done. What you are able to see here? Tibio-talar dislocation is what you are able to see, doctor. Rakesh Patel says, सर केवल इमेज सीन होता, अगर रिटन वर्ड भी क्लियर हो सकता तो अच्छा रिवीजन हो जाता. बहुत अच्छी बात है राकेश भाई. See, there is on the, you go to learnograph.com. So you make a point to go to learnograph.com. वहां आपको मिल जाएगा, क्या मिल जाएगा? All the PDFs of the 50 full-scale grand tests we keep uploading. Already 19 tests have been uploaded. So download the PDF. It has all these mind maps and 200 mind maps in every question paper. So in the starting, you will get the question paper, keep a timer, solve the paper, और बाद में आप नीचे वाले माइंड मैप्स को गए तो ये सारे माइंड मैप्स मैं उसी पीडीएफ से आपको पढ़ा रहा हूं अभी. ठीक है, तो दैट्स हाउ यू विल हैव रिवीजन. सो प्लीज डू कॉल 9000868356. if you don't want to pay $500 for every full scale mock test NEETPG ka, all 50 full scale NEETPG mock tests you can get for as low as 10,000 rupees. So please do WhatsApp and call our helpline and they will help you to buy the subscription. So doctor, mainly what is the purpose of this live class? हम ऐप में सब्सक्रिप्शन लेते, उधर फेस टू फेस क्लासेस में पैसे भर्ती करते, इधर जाते उधर जाते, मगर पढ़ते नहीं. वो स्टडी मटेरियल इधर से डाउनलोड करते, उधर से डाउनलोड करते, मगर पढ़ने के लिए वो ख्वाहिश होना चाहिए. वो कैसे मिलेगा? अगर पढ़ाने वाले मिल गए तो पढ़ने का भी ख्वाहिश मिलेगा. वो पढ़ाने वाला मैं, पढ़ने वाला आप है, और हम आपके हाथ पकड़ के आगे लेके जाएंगे ताकि आप रोज पढ़ेंगे और हम आपका स्टडी मेट, रूममेट, क्लासमेट, बेंचमेट, टेबल मेट क्यों नहीं मिलेगा सीट. Let us take it like a challenge and bet. So every day take the test, solve the 200 questions, and then come for the discussion. At least 50, 60 or 100 questions, जितना भी हो सके मैं आपका हाथ पकड़ के रिवीजन करूंगा. बाकी क्वेश्चंस आप अपने आप रिवीजन करो, 2-3 दोस्तों के साथ बैठ के रिवीजन करो, कोई बात नहीं. Right? So that is what you have to do, doctor, to become a winner. Right? And you need to know what is focused content, what examiner exactly wants, how to get the practice to that content. That is all you get from the 50 full scale mock test by Dr. Murali Bhardwaj. So, doctor, so this is tibio-talar fracture dislocation. A patient presents with a severe abdominal pain, vomiting, inability to pass the stool or gas. Abdominal radiograph has been done. So what is it showing? Dilated small bowel with the air fluid level, which is indicative of obstruction. And there is no gas in the colon, confirms that it is a high-level complete intestinal blockade is what you need to remember. So it is acute intestinal obstruction. A patient with the lesions which are being shown to you. So how are these lesions? They're all very, very bullous lesions, right, doctor? So large, dense, clear, fluid-filled blisters. surrounded by inflamed skin. What does it indicate? Bullous pemphigoid, where there is a subepidermal blistering. Subepidermal blistering is what you will be able to see, right? Now, doctor, a child presents with persistent itchy rash. What you can see here, itchy rash. It worsens with the dry weather. It is seen in the popliteal area, which is typical of atopic eczema, is the diagnosis. A patient with the lesions which are being shown here on the elbows, right, doc? On the elbows, on the extensor surfaces, classical of psoriasis. A patient with history of type 2 diabetes with the lesion shown. This is necrobiosis lipoidica diabeticorium is what you need to remember. So all the high points about necrobiosis lipoidica diabeticorium is all made available for you to discuss in the mind map, doctor. So 200 mind maps are accompanying, where you have the comprehensive review of the entire topic in one place. Nowhere in India you have this kind of a examiner what exactly he wants. हम सब ऐप पर खरीदते, वो खरीदते, ये खरीदते, मगर रिवीजन करने के लिए मन नहीं लगता. इधर तो होता आपको पीडीएफ डायरेक्टली आपके लैपटॉप हो तो लैपटॉप, फोन हो तो फोन, कहीं भी डाउनलोड करके रिवीजन कर सकते, अपने फ्रेंड्स को भी डिस्ट्रीब्यूट कर सकते फ्री में, राइट? सो नाइस टू सी मुत्तु कुमार. Very good. Keep punching your answers, doctor. Patient undergoes an ultrasound. So what do you see in ultrasound, doctor? Hyper echoic bright echoes within the gallbladder with a gravity dependent movement whenever the patient's position changes. And the posterior acoustic shadowing, classical of the gallstones. So whenever gallstones is there, you are clinically suspecting gallstones. Then what is the best way to investigate? Ultrasound. Thick-walled gallbladder, hypoechoic formations, posterior acoustic shadowing, they're all characteristic of the gallstones is what you should remember. A patient presents with the lesions which are being shown to you. Okay, bhaiya? So what are these lesions is the examiner's question, right? Recent episode of joint pain is there along with the skin lesions. Also, there is abdominal discomfort. All of this is suggestive of Henoch-Conlin's purpura, which is a vasculitic purpura, typically presents. And the vasculitis can involve anywhere. It can be mesenteric vasculitis leading to the development of the abdominal pain is what you need to remember. Now, during a gastrointestinal endoscopy, there is a lesion that is being found along the lesser curvature of the stomach. So typically, it is the gastric ulcer, most commonly found in the lesser curvature. They penetrate the muscularis mucosa. They can vary in size and depth. Most commonly, they show edema, inflammation in severe cases, with the visible vessels or active bleeding can also be seen in case of gastric ulcer. A patient presents with abdominal pain, vomiting, inability to pass the stools. Upright abdominal X-ray has been done. So what can you see, doctor? Multiple air fluid levels, which indicate that there is a fluid and glass which are separating, classic sign of obstruction. So there is no gas in the colon, which supports the diagnosis of a small bowel obstruction, is what you need to remember. During a GI endoscopy, patient with known liver cirrhosis is found to have these lesions on the endoscopy. So what are these, doctor? These are the gastric varices, especially in the view of background of cirrhosis of the liver. These are the gastric varices is what you need to basically remember. Muhammad Manasir Hussain, thank you for the feedback. These test series are more than excellent. There is something called more than excellent. Very good. I only know good, better, best. These are very best. Thank you, Manazir Hussain bhai. They cover each and every important word of the exam. Really great. So you made my day with a good compliment. So, doctor, life is a series of compliments that we relish. So most important thing is, doctor, I see a lot of times students complimenting, whatever, sir, आप बहुत अच्छा पढ़ाए, आप बहुत अच्छा गाया, मगर बादशाह आप भी जरा रिवीजन करना, आप भी जैसे टीचर पढ़ा रहे उतना ही शानदार आप भी पढ़ना. That is the most important thing, and every teacher's objective is always to encourage you to study, inspire you to study. So that is most important thing, doctor. So lot of beautiful things in the world, they're all very free, they are very cheap. Just like this YouTube live discussion, this is completely free. Just inform all your friends, यहाँ रोज अच्छा माल मिलेगा आपको YouTube चैनल पे, और लखनऊग्राफ.com को गए तो और अच्छा माल मिलेगा आपको रिवीजन करने के लिए. Right, doctor? Now, a 54-year-old with anemia undergoes screening. So any irregular mass in the rectum, in the colon, yeah. So with the anemia, every above 50 years, whenever anemia is there, evaluate for any source of bleeding coming from the gut in the form of colon cancer. So that's the reason colon carcinoma, classical appearance. A patient presents with a lesion on the face, and you have done the dermatoscopy. What you can see, fine branching vessels. दिख रहे ना? Fine branching vessels, बच्चों, दिख रहे ना? हाँ. So this is what you call the basal cell carcinoma, is what you have to basically remember. Very good. Very nice to see. Ikra commenting it as basal cell carcinoma. Very good, Dr. Ikra. Keep commenting, doctor. That is the whole idea behind this mock test series discussion. आप भी 2-3 साथियों के साथ बैठ के डिस्कशन करना है. So that completes our first set of 40 questions. What is the new pattern of NEETPG? 40, 40, 40, 45 sections of 40 questions. मेरा पहला 40 questions हमारे mock test में होता है image based, that you need a discussion with Dr. Murli. Remaining 160 clinical vignette based questions. Very few single liners are coming in the recent exams. 10-year-old boy with a 2-day history of abdominal pain. Psoas sign, pain on passive extension, is a feature of appendicitis. Bilateral internuclear ophthalmoplegia, where one eye cannot adduct and the other eye, which is abducting, shows nystagmus, is called as internuclear ophthalmoplegia, is a feature of multiple sclerosis. It is L1 nerve root compression in this 40-year-old male. L1 nerve root compression, pain radiating to groin, diminished sensation in the inguinal region. Positive straight leg test often indicates L1 or L2. Narrow root involvement is what you need to remember. Now, a 79-year-old with a history of hypertension, loss of pain and sensation after accidentally cutting his hand. He takes lisinopril for hypertension. There's a lesion in the brainstem, right? So, any trigeminal nerve involvement lead to loss of sensory from the face, loss of facial sensation ipsilaterally. Now, the anterior spinal artery is the one which supplies the medial part of the medulla, where the corticospinal tract and medial lemniscus are located. That's the reason sudden onset of contralateral hemiparesis and loss of proprioception without facial sensory loss is characteristic of medial medullary syndrome, is what you need to remember. Whatever, very nice to see Dr. Anita Rani. Good, Anita. We have a lot of hopes on you. Hope that in spite of being in government service, you accumulate all that required courage. Have 4 or 5 friends. Never अकेला नहीं पढ़ना. 2-3-4 साथियों के साथ बैठ के पढ़ो और ज्ञान बांटो. Then only you will become a winner and topper. So, whenever the PhD doctors become toppers, it's like a 7-star major general kind of a feeling that I get. Parama Shaurya Chakra, right? Any recent fresher getting top rank is okay. That even without my help also they will get it. But the real help is needed for those people with all the social drama of life that surrounds us, with so much work tensions in the employment. Still, you are fighting with that goodwill and willpower. That is the need of the hour. Thank you, Anita. Late but latest arrival, right? Now, doctor, the next question. Her symptoms began suddenly after she reported a funny feeling in her right arm and leg. So there is a medial medullary syndrome. Indirect inguinal hernia is the most common type in the newborn, often because the patent processus vaginalis. So this baby is having a bulge in the inguinal area that extending into the scrotum, especially noticeable when the child is crying because of the increased intra-abdominal pressure. A 5-year-old with diarrhea, lethargy, anemia, thrombocytopenia, renal dysfunction, elevated creatinine is hemolytic uremic syndrome, which is caused by E. coli O157H7 strain after eating undercooked meat. 32-year-old with dysuria, gram-negative diplococci in the urethral discharge suggests Neisseria gonorrhea. In the first-line treatment is always ceftriaxone is the treatment of choice. So, very nice to see Shaina Sharma. Very good. We are becoming very popular, doctor, nowadays. Thanks to all of you for giving your time to come and listen to this aging teacher. So, in 2000, when I was preparing for entrance exam, I said, why I study and I also teach. 300 students came and sat in a school from Usmania Medical College, Gandhi Medical College, Deccan Medical College. Only 3 medical colleges were there in Hyderabad that time. In the past 25 years, that time I became a topper. Every day, early morning, 4 o'clock to 7 o'clock, I used to take a class in a school with a piece of chalk. For them, I used to prepare whole night preparing the notes for them, take a photocopy and give to them. I myself was also preparing for entrance that time. And I became a first ranker, joined MD General Medicine. And my students in the first 100, they got 97 ranks in that 2000 batch. From then onwards, 3 lakh medical students, I had a fortune to be a mentor to them. So many free videos on the YouTube, almost 2000 videos I have put up on this YouTube channel. So what you need to know is the true love, the best gift, the best knowledge is mostly free. Remember that. So just because we paid 1 lakh to a coaching program, some teacher flies in an aeroplane and delivers a class doesn't make us a topper. We need to consume the content. We need to practice the content and then become the topper. So always keep that in mind, doctor. Next 40 days is a beautiful time for you to become a topper. So 47-year-old, unprotected intercourse, hepatitis B serological marker. So remember, envelope antigen is a marker of active replication and high infectivity is what you need to appreciate. So all the clinical features given are suggestive of whooping cough, which is caused by Bordetella pertussis. So what is the mechanism of action of the whooping cough, doctor? So very nice to listen, doctor. Elon Musk is also saying 100% correct, right? 100 correct questions, sir. Wow, very good. So inactivation of elongation factor 2 is the mechanism of action, right? So the exotoxin produced by pertussis inactivates the elongation factor 2, which is the crucial protein synthesis, which is very crucial in protein synthesis is what you need to remember. So Elon Musk is saying my GT scores are just 100. Elon Musk, you should drive your preparation like that automated vehicle, right? Remote vehicle. What you need to do is 100 questions you are right, but 100 you are wrong means you are having the mind map, all points about that topic. Fatapat revision karo, Elon Musk. You are the best. Recently you bought the Twitter also, right? So when you are so successful, you have to crack the NEETPG top rank. Otherwise, all the Twitterites will be disappointed, Elon Musk. Please come to the live class every day. We will be very happy, right? So now, doctor. 50-year-old male worker in Bangladesh, profuse watery diarrhea, signs of severe dehydration, stool smear shows no WBCs. So, cholera. So, how does cholera toxin act? It acts as an adenylate cyclase, is what you need to basically remember. Now, a biotechnology company is developing a protein to prevent anaphylactic reactions. So it is the IgE surface receptors on the mast cells and basophils, which are very central to the anaphylactic pathway, is what you need to remember. Now, 30-year-old with high fever, sore throat, difficulty breathing, it is all suggestive of Corynebacterium diphtheriae infection. So we use Bordet Gengaus agar as a culture medium. So 12-year-old boy after camping trip presents with fever, headache, muscle ache, spreading rash. It all looks like Rocky Mountain spotted fever. Doxycycline is the treatment of choice for rickettsial infections. Doctor, remember, whenever a patient has got a fever, आप सब कुछ इस्तेमाल किया, फीवर नहीं कम हो रहा है, तो खाली 2 चीजें ऑप्शंस आपके सामने हैं. एक, वो टीबी हो सकता, देख लो. अगर नहीं हुआ तो गिव ए शॉट ऑफ डॉक्सीसाइक्लिन for about 1 week. A lot of times fever will subside. That's a secret of the clinical practice. 53-year-old with diabetes, systemic symptoms and a recent history of cholecystectomy. There are hematological abnormalities consistent of coagulopathy like DIC. So we need to replenish those coagulation factors, which we can do by giving the fresh frozen plasma is what you need to remember. A 16-year-old girl with abnormal vaginal bleeding along with vulvar itching. So typically frothy yellow-green vaginal discharge with a strawberry cervix. Colpitus macularis is a feature of trichomonas vaginalis. It produces profuse, frothy vaginal discharge is very, very characteristic. Headache, blurred vision, guide disturbance along with the imaging showing enlarged ventricles means hydrocephalus. Perivascular pseudo-rosettes on the biopsy, classical of ependymoma is what you need to remember. Inability for the right eye to move past the midline when looking to the left suggests a problem in the left sixth cranial nerve which controls the lateral rectus, and the abduction is what you need to remember. Very nice to see 10 online classmates, doctor. Petechiae, oral mucosal bleeding, bone marrow findings suggest a platelet disorder like ITP, which can lead to thrombocytopenia without any other bone marrow abnormalities. Bone marrow is able to produce, but there are antibodies generated against the platelets which are destroying the platelets peripherally in ITP. 57-year-old plumber by profession in the shipbuilding presenting with pleural thickening with calcified blocks is equal to asbestosis. 7-year-old boy, long day in the sun, got dehydrated, developed vaso-occlusive crisis with crying. It is called acute chest syndrome in sickle cell anemia. 7-year-old boy with generalized edema, significant proteinuria, absence of glucosuria, ketonuria is equal to nephrotic syndrome, most commonly caused by minimal change disease is what you need to remember. 26-year-old postcoital bleeding. Cells with large nuclei, open chromatin, mitotic figures in cervical cytological specimen means HPV infection, which is associated with cervical dysplasia, cancer. Coilocytes with perinuclear halos are indicative of human papilloma virus effect. 26-year-old treated with HIV, right? So, non-competitive inhibitor of the reverse transcriptase is nevirapine, is non-nucleoside reverse transcriptase inhibitor is what you need to remember. Now, doctor, 55-year-old male with a history of hypertension, right? So, if you use beta blockers, they reduce the sympathetic stimulation of the heart. They decrease the end diastolic volume, blood pressure, and the contractility is what you need to remember. 19-year-old after recovering from the bacterial meningitis, experiencing headache, blurred vision, guide disturbance, enlarged ventricles. So whenever there is a meningitis, post-meningitis, there can be granulations which can form in the arachnoid, and that can lead to the development of the typical hydrocephalus. Hydrocephalus post-meningitis. 52-year-old, sudden onset of severe chest pain and collapses and pronounced death, and there is a ruptured aneurysm of the aortic root with the nodular lesions on the skin. The presence of the skin nodule suggests a systemic condition like cystic medial necrosis is the diagnosis, doctor. So aortic aneurysm ka etiology, presentation, risk factors, pathology, diagnosis, treatment, everything you should be very sure about. A newborn presents with a continuous heart murmur. The infant mother did not receive any immunizations. Continuous murmur means patent ductus arteriosus, which is maintained by prostaglandin E2. You want to close it, then you need to use the inhibitor of the prostaglandin E2 is what you need to remember. So ECG shows PSVT. To control SVT, what is the drug of choice, doctor? Adenosine is the drug of choice. Adenosine. So once more, doctor, I leave the literature for you. SVT, how do you treat? What are the drugs available? What is the first line drug? Everything as a mind map. I'll give you in the PDF. Please do download, right? It is available on the learnograph.com. I leave the link below this video. You can go there and can buy the PDF of the question booklet with explanatory answers. High triglycerides, moderately elevated LDL cholesterol is started on a medication that is lowering the LDL and triglycerides while raising the HDL. So Gemfibrozil is a fibric acid derivative that activates the PPAR alpha peroxisome proliferator activated receptor alpha nuclear transcription regulator. Activation of the PPAR alpha causes increased oxidation of the fatty acids in the liver and the muscle. By that, it reduces the triglycerides. The Gemfibrozil is what you need to basically remember. A 48-year-old with a history of hypertension, family history of early heart disease, has ST segment elevation. If you do 8 hours after the MI onset, acute MI, what do you see? Neutrophilic infiltration is the early histological change after the MI is what you need to remember. So everything about the changes in MI, pathologically, you need to be very sure. A 58-year-old with hypertension is found to have a S4 heart zone. And on the pressure volume loop diagram, point A represents end diastolic volume just before ventricular contraction. Actually, that image is missing here of that diagram. So, yeah, 67-year-old with diabetes, renal failure, presents with chest pain. It improves when leaning forward, diffuse ST elevations, PR depressions. So all this is indicative of pericarditis. We use NSAIDs to reduce the inflammation and pain in pericarditis. So pericarditis presents with diffuse ST elevation along with the PR depression is what you need to basically remember. So doctor, the last question for today's evening. 87-year-old with ST elevation MI becomes unresponsive after treatment with aspirin, metoprolol, heparin. Despite multiple defibrillations, he remains in ventricular fibrillation. So, a medication associated with which adverse effect is likely administered in this patient? So, refractory ventricular fibrillation post-MI need to be treated with emidaron. But emidaron is associated with pulmonary fibrosis is what you need to basically remember. So, doctor, आज हमारा चाय पे चर्चा को समाप्त करेंगे. रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे भाई मेरा नंबर आ गया. 50 full scale grant test is all the secret that is going to take you to become the topper in the first 1,000 ranks, doctor. We'll once more meet tomorrow. Thank you.